Welcome everyone to today's webinar, Shifting Collections from Patients to Payors, Establishing a Payor Reimbursement Program that drives revenue, profitability, and excellent patient experience. I am Angie Stewart with Becker's ASC Review. We will begin today's webinar with a presentation, and we'll have time after the presentation for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. John Bardis serves as CollectRx's Chief Executive Officer. Mr. Bardis is a veteran in the field of healthcare and information technology. As president of Dr. First, Inc. and executive vice president of Prematics, Inc., Mr. Bardis has specialized in providing cost containment services to health insurers and various products and services to hospitals, health systems, and other healthcare providers. Previously, Mr. Bardis was an attorney at Kirkpatrick & Lockhart LLP, now K&L Gates, where his practice focused on litigation. Mr. Bardis' clients have included a wide range of for-profit and not-for-profit health insurers, including Blue Cross Blue Shield of Florida, Humana, Capital Blue Cross, Kaiser Permanente of the Mid-Atlantic region, CareFirst, and Blue Cross Blue Shield of Massachusetts. Mr. Bardis has also worked on behalf of numerous hospitals and health systems, including Henry Ford Health System and MedStar Health, along with hundreds of physician practices. Franklin Smith serves as CollectRx's Director of Revenue Cycle Management. Mr. Smith has worked in the revenue cycle management industry for 30-plus years. He was employed by Calvert Memorial Hospital for nearly 16 years, serving in numerous capacities as a transformative revenue cycle leader. Previously, Mr. Smith consulted as a revenue cycle operational efficiency expert and fiscal improvement strategist for a variety of mid- and large-sized healthcare providers. He began his career in the healthcare industry by working in the claims management department for Blue Cross Blue Shield. Mr. Smith's experience with billing operations and the ability to provide strategic leadership and sales support regarding the client's revenue cycle increase continues to be an essential component of CollectRx's rapid growth in the RCM business. Mr. Smith holds a BS degree from Virginia State University and a certification as a Certified Revenue Cycle Executive from the American Association of Healthcare Administrative Management. At this time, I am pleased to turn the floor over to John and Franklin to begin today's presentation.
Thank you, Angie. We appreciate the introduction. Again, I'm John Bardis, CEO of CollectRx, and I'm joined here today by Franklin Smith, who heads up our Revenue Cycle Management Group. And we're going to be talking today about collections. That is about shifting collections from patients to payors, establishing a payor reimbursement program that drives revenue, profitability, and excellent patient experience. We're excited to be here today to talk to you about the current state of collections, current and pending changes in legislation, and how you can optimize your collection strategy right now to ensure that you are able to continue to see those patients who want to see you and be fairly compensated for your services. So more specifically, I'm going to be speaking about current reimbursements and payor trends, the state of patient collections, best practices to maximize payor reimbursements for both in-network and out-of-network claims, and how implementing a payor reimbursement program that leverages technology and expertise can dramatically impact the financial side of your business. Now, before I dive into those topics, let me spend a minute or two just giving you a quick summary of our experience in payor reimbursement and in-network and out-of-network claims so you understand why we're in a position to address these issues. Despite our name, we have nothing to do with the pharmaceutical industry. Simply put, what we do here at CollectRx is we help providers get higher reimbursements on in- and out-of-network bills and maximize your collections. We do this not as consultants, but as experts in negotiating and appealing in order to achieve higher reimbursements on your bills and collections. CollectRx has been singularly focused on helping providers get higher reimbursements since 2006. We've helped more than 2,100 providers nationwide to optimize their reimbursements on in and out of network collections. We work with a variety of different provider types, including surgery centers, physician groups, hospitals, and labs. And we rely on two things to get the results we get. First, we rely on what we call CRIXIS, which stands for CollectRx Information System. This is a proprietary data and analytics tool that we've developed here internally that helps us as we go toe-to-toe with the payers. CRIXIS also helps us analyze insurance policies, provides comparable data, and allows us to track the trends and tendencies of the people on the insurance company side. The second key to our success is our expertise. What we've done is we've built a unique team of experts who used to work on behalf of the insurance industry and their vendors. This puts us in a unique situation that we're able to understand the soft spots in the payer's positions and get higher reimbursements on bills for our customers. So that's us in a nutshell. Let me go ahead and get started here. The first thing we're going to cover is trends in patient collection. So setting the stage here, let's look at the bigger issues around the costs of healthcare and the shift in the burden of payment. JP Morgan shows that out-of-pocket healthcare spending increased 8.5% between 2016 and 17, the fastest growth occurring over the latest 3 years. Here are a few other statistics that are useful when thinking about patient billing and relation to the payer reimbursement. Today's average deductible is nearly $2,000, and the average maximum out-of-pocket is nearly $4,500. 30% of the average healthcare bill comes directly from the patient's pocket. Among people with health insurance, 1 in 5 working-age Americans report having trouble paying medical bills in the past year that often causes serious financial challenges and changes in environment and lifestyle. This puts providers in a difficult position of having to collect more of the patient's hard-earned income while still trying to maintain a positive doctor-patient relationship. So what about surgery centers? According to our own Becker's ASC report, for the past several years, ASCs, frankly, like many or most healthcare providers, have witnessed firsthand a growing shift in the responsibility of the payment of services from payers to consumers. This has created multiple obstacles for the delivery of surgical services, including the ability for patients to cover their expenses in surgery centers to collect what is owed to them for performing their procedures. As we've discussed, there's been a substantial increase in patient responsibility, and at the same time, surgery expenses have surged. From 2012 to 2016, in that time period, outpatient surgery prices increased by 19%. Patients are increasingly focused on cost, and according to Instamed, 65% of consumers indicate that they would consider switching healthcare providers for a better payment experience. Providers are struggling to address patient needs with respect to cost expectations. Despite the growing demand from patients for more information about their medical care expenses, providers are coming up short in matching these needs. Westcorp data indicates that 3 out of 4 patients say they do not know the cost of their health care insurance until they receive the actual bill. About 30% delay medical payments because of confusion over what expenses were covered by insurance and what they still owe. And patients are experiencing significant negative effects on their health and financial well-being. NORC at the University of Chicago states that 40% of people skip necessary medical tests or treatment due to cost, and 28% of patients had a medical bill that has been turned over to a collections agency. 37% of consumers have unpaid debt from medical bills, according to the Federal Reserve. All this leads us to issues with respect to payment and collections. According to a report from TransUnion, a significant percentage of bills are not getting paid. 63% of hospital bills were $500 or less, and of these, 68% were not paid in full. 10% of hospital bills were $500 to $1,000, and 85% of those were not paid in full. And 4% of hospital bills were $3,000 or more, and of those, a whopping 99% were not paid in full. According to the Go Practice blog, patient balances are getting harder and harder to collect. 65% of bad debt belongs to insured patients. The average recovery rate for a medical practice's bad debt is over 21%, and 1 in 5 insured Americans encounter problems paying medical bills. And according to News Network, it costs a provider 4 times more to pursue debt collections from a patient than from a payer. And from the Black Book, survey findings from about 1,600 physician practices and 200 hospitals and 50 hospital health systems reveal that the current methods for collecting from patients just aren't working. Profit margins continue to be impacted, and 80% of medical providers and 92% of hospitals plan to jettison time-intensive efforts to reconcile bills. And according to a new analysis from TransUnion Healthcare, with patient payment representing a growing share of a health system's revenue, consumers and providers are being put in a more and more precarious position. Hospital bad debt is rising with the growing share of patient financial responsibility. Patient balance after insurance has risen from 8% to over 12% in the last 2 or 3 years. And with the cost of collections as well as the success rate, the continuation and growing debt is growing. And finally, don't forget how negative billing interactions affect patients and payments. Patients who are very dissatisfied with business office interactions are more likely not to pay their bill willingly, and out-of-pocket expenses affect provider selection. More than 50% of patients indicate that out-of-pocket costs will have a significant or highly significant influence on provider choice. Okay, now let's switch from the patient side to talk about payer reimbursements. And as you know, the past several years have been a bit of a roller coaster ride here. And sometimes it helps to sort of take a step back and see how things you're experiencing on a daily basis are reflective of what might be going on at a macro level in terms of healthcare and the reimbursement situation. Far and away, the number one issue that providers face is the reduction in reimbursements. It's important to remember that the payers and the vendors who work for the payers are working continually to reduce reimbursements and underpay claims. And today, payers use a variety of tactics which allow them to reimburse providers at anywhere from 20 to 50% of billed charges. These tactics work. They're largely successful, resulting in a significantly lower payout to providers for services that are delivering to the payers' subscribers. And there's a growing gap in the individual market between premiums collected and the claims per member from 2011 to 2018. While both are growing at a healthy clip, the last 2 years have seen a marked divergence between the premiums and payments to providers. Simply put, payers are not compensating providers at the same rate that they are increasing their premiums. Loss ratios began to decline in 2016 and continued through 2017 and 18, partially due to relatively large premium increases. Loss ratios have continued to decline, averaging 69% in the first 6 months of 2008. And remember, the data analyzed here relates to the individual market, where there's an actual requirement to not go below 80% medical loss ratios, or be forced to rebate premiums. In the non-ACA payer marketplace, there is no such requirement. And finally, in some I would call sort of startling statistics, claims denials are big business for payers. First, the Department of Labor establishes that in 1 in 7 claims is rejected, or the equivalent of 200 million denials a day. There are any number of reasons why this is occurring, but at the end of the day, providers and patients are left holding the bag with 14% of their claims. Second, for Medicare Advantage plans, appealing pays off tremendously. Only 1% of denials are appealed, but of those that are appealed, 75% are successful. Similarly, with ACA plans, with almost 1 in 5 claims denied, only 200,000 of the 43 million denials were ever appealed. ACA marketplace plans denied an average of nearly 1 in 5 in-network claims in 2017, with denial rates ranging from 1% to more than 40% across insurers. And a Change Healthcare analysis says that its data shows that an estimated $3 trillion in claims submitted by hospitals in 2016, an estimated 9+% of charges were initially denied. And even though the same data shows that up to 63% of denied claims are recoverable on average, representing over $260 billion in revenue, it may cost hospitals and health systems nearly $9 trillion to maintain administrative costs to recover that money. Reasons cited for appealing: complexity, expense, lack of time, and probably most importantly, lack of expertise. So let's switch gears again and start talking about the current legislation regarding surprise medical bills that's getting a lot of attention, as well as balanced billing. Now, surprise medical bills, they really occur in a couple specific situations. One is an individual who's insured is inadvertently receives care from an out-of-network provider. For instance, an emergency room situation. The patient ends up in the emergency room, may be unconscious and unable to give that information, and end up using an out-of-network provider. Another situation is when the patient is using a in-network doctor, let's say, and they're unknown to the patient, there's an ancillary service that's being applied as well, such as an anesthesiologist. So again, you have the emergency room situation and the ancillary care provider situation. Those are the main times that the surprise bills comes up. So for patients, when given a list of possible worries, unexpected medical bills top the list that includes other healthcare costs such as premiums, deductibles, and even drug costs. 4 in 10 insured adults ages 18 through 64 say there's been a time in the past 12 months when they received an unexpected medical bill, and 1 in 10 say they received a surprise medical bill from an out-of-network provider in the past year. As a result, a variety of legislative actions aimed at reducing the impact to consumers have been introduced. They are one of the main reasons why getting a clear idea of how to manage your billing when the patient is not involved will become a more and more important situation in the future. So, in an emergency room setting, patients are often unable to ensure that they go to an in-network emergency room. The Affordable Care Act, the ACA, provides for partial protection for patients receiving out-of-network emergency care. The ACA requires all non-grandfathered health plans to cover out-of-network emergency services and to apply the in-network health level of cost sharing to such services. However, the ACA does not prohibit balance billing by facilities or providers for providing emergency care. As a result, patients can and do receive surprise bills for emergency room care from such facility and from providers who also treat the patients in the ER. Of the ER visits in 2017 by people with large employer coverage, it's estimated that 18% had at least one out-of-network charge, either from the facility, the provider, or both, associated with the visit. This includes out-of-network charges from the emergency facility, emergency room providers, and provider and facility charges associated with the resulting inpatient stay when applicable. An unexpected bill from an out-of-network provider can be stressful for folks. But as insurers continue to pursue narrowing networks in an attempt to reduce their costs and maintain their profit margins, more and more patients will seek emergency care and may receive a surprise bill. Currently, insurers believe that narrow or skinny networks are necessary to reduce costs. A number of states have, in fact, enacted laws to protect their consumers from surprise medical bills, though these state laws generally do not apply to people with large employer health insurance coverage where employers largely self-insure. There are up to 9 states that have enacted or implemented laws that take a comprehensive approach to surprise bills. There are 4 more states that have passed legislation, but they have not taken effect yet. And these comprehensive state laws share some common features. These comprehensive state laws hold consumers harmless against surprise medical bills. And in addition, laws prohibit providers from balance billing patients covered by state-regulated plans. Instead, the out-of-network provider is limited to collect no more than the applicable in-network cost-sharing amount from the patients in cases of surprise medical bills. Resolve payments for surprise bills approaches may vary, with some states adopting a payment standard for all applicable surprise medical bills, with other states establishing a dispute resolution process that insurers and providers can use to arrive at a payment amount for each surprise medical bill. And some states use a combination of both. Limits to state law protections because of federal preemption. All states have limited jurisdiction to protect privately insured residents from surprise medical bills due to ERISA. And because of this preemption by ERISA over the state laws, you have a situation where you need to have a federal law in order to get it actually passed. These bills, they have a lot in common. Lawmakers agree that patients must be protected during this settlement process for a surprise medical bill, and that they should only be liable for what their copayment would be in an all-in-network facility or with in-network providers. They also agree that any legislation should apply to any healthcare facility or payer type. The President has called on Congress to pass a bill with respect to surprise medical bills, and again, they're being worked on but have not been passed. So to summarize the current situation, all proposed legislation includes a prohibition on balance billing patients. Many of the state and federal proposed legislation include provisions for negotiation using usual and customary rates as the basis. Most legislation is specific to emergency and ancillary providers, as we discussed. Arbitration clauses include many of the proposed bills are considering as favorable to the providers. And while the benchmarking approach is favored by the payors, the indexing against usual and customary is much more aligned to the current approach and seems to be included in many of the state initiatives. So given all this, what's the best practice for you to ensure that your collections are most effective? You need to ensure that your payer collection strategy is in place and working well. And to help in that regard, let me turn it over to Franklin.
Thanks, John, for a great overview of the current landscape. Given the trends in the market, we highly recommend to our clients focusing emphasis on collecting from payers rather than patients. And here are our top 10 best practices that can help you do that. The first best practice is to analyze every account to ensure you'll maximize your reimbursement. It may seem obvious, but with the complexity of the reimbursement environment as well as billing systems that we use, ensuring that you are touching every claim to verify that it has been paid at the correct, appropriate, and most importantly, highest rate is critical to maximizing your payer reimbursement. Analyzing every claim is extremely challenging when you're using your billing system alone or manual approaches. By implementing technology that acquires data from the payer websites, you can quickly and easily automate your workflows with real data in real time rather than relying on spreadsheets and manual data entry to ensure you receive the correct payments. Best practice number 3 relates to the use of data and technology to ensure that you look at every claim every time. When you use technology to help manage the payer reimbursement process, you are able to quickly identify and prioritize at-risk accounts before they become a problem. Then you can leverage workflow technologies assigned to each for follow-up, thus ensuring that nothing falls through the cracks or is missed due to some type of oversight or employee staff non-compliance. Claim denials, underpayments, and delays may be a part of life, and not even maybe, they are a part of life for healthcare revenue cycle managers, but a prevention-focused denials management strategy can significantly reduce the number of times billing staff are faced with unpaid claims. You can drill down into your data on unpaid claims to discover root causes and implement targeted fixes that can improve your revenue profile significantly. The Medical Group Management Association, also known as MGMA, found that approximately 65% of claim denials were never corrected and resubmitted to payers for reimbursement. You must put processes and automated technology tools in place to immediately identify your denials and resubmit them as quickly as possible to prevent any timely denials that may start to surface. Best practice number 6 focuses on actually appealing the claims. When the insurance company reprices an out-of-network bill down to what they, quote-unquote, consider to be reasonable and customary, which is typically close to the Medicare rate, you need to appeal that payment. From their perspective, the insurance company takes the position that they have met their obligation in paying the bill. But you need to appeal by leveraging data and expertise in working with payers to back up your stance that their payment was not reasonable. Rigor is the key here, and as they have an entire playbook dedicated to continue to roadblock your efforts. The key to success in negotiating with payers is to leverage historic data. You need to be able to present a compelling case, and showing them data demonstrates that they have paid at a higher rate is critical. Best practice number 8 is to reconcile. When you implement a rigorous payer reimbursement system that includes appealing claims for additional payments, it's critical that you can reconcile first and additional payments with the initial claim to ensure that you are receiving the highest reimbursement for tracking and data analysis purpose to be leveraged down the road for the next incident. Best practice number 9 is again reconciliation, but in this case, it's ensuring that you track every single account. For each account, not only the ones that have multiple payments, it is critical to reconcile from assignment to zero balance. This provides the data you need to allow you to evaluate the success of your program, evaluating your collections across multiple facets, compare the CPT code, and yes, to your internal collector. This data is critical to identifying bottlenecks and weak points and helping you to optimize your entire revenue cycle. And finally, best practice number 10. Outsourced solutions are more and more common and on the rise according to the Black Book report. Approximately 83% of hospitals currently outsource some accounts receivable and collections, while 68% of physician groups with 10 or more practitioners outsource a combination of collections and claims management, particularly when it comes to complex claims and the pace of change in the healthcare billing. Leveraging expertise maximizes your chances of significantly improving your bottom line. So, putting it all together, what is a payer reimbursement program? Succinctly, a payer reimbursement program is simply the strategy, the tools, processes you implement, and the metrics you choose to judge their performance that ensures you collect the maximum reimbursement from your payers. There are 4 major components to a robust payer collection strategy that let you maximize your reimbursements and shift your strategy from patient to payer collections aligned with your revenue cycle. First is patient access. Maximizing revenue starts with the most effective patient access processes and understanding how to optimize both the front end of your business as well as your patient experience and the collection. The goals at this stage is to improve on your accuracy, reduce the nows downstream, improve your financials with CollectRx Revenue Cycle Management Integrated Patient Access Solutions. Those include patient registration, eligibility and verification, authorization, and out-of-network reimbursement calculation. Next phase is billing and coding. We need to maximize claims revenue, increase total reimbursements, and reduce the nows and underpayments by ensuring your claims are coded and submitted correctly. Medical coding is becoming more and more complex, and without the resources that can navigate as the industry changes, you run the risk of reduced payments across all your payers. Focus on increasing your expertise, your technology, data, and processes to enhance accuracy and efficiency, reduce your billing errors, and your unpaid claims. Some major areas to focus on include your coding and documentation review, charge entry and reconciling that you have all of those charges entered, and billing and claims processing. Collections also is a part of the solution. This is really where the heavy lifting with any payer reimbursement program lands. No matter your claim type, you need to be able to work across all payers to ensure that every claim is reviewed, the nows and underpayments appealed, and the first and additional payments reconciled to ensure that you are getting the payments you are entitled to. The goals at this stage are to increase cash collections, to automate your processes, reduce your AR days, and ensure that each claim is paid at the highest rate possible. The goal is to get all your claims paid correctly, completely, and finally on time. And that includes AR follow-up of your outstanding AR and balances, appeals for denials and underpayments, completion of out-of-network negotiations, and of course, payment posting and balancing to ensure that the accounts you're actually trying to collect are indeed collectible accounts. Last but not least, data reporting and analytics are critical to any operations. Ensure that your billing department is data-driven and is able to address the challenges of the most complex claims. Insist on leveraging data, reporting, and analytics to understand your revenue cycle and provide the right recommendations to help you maximize your collections. Build easy to understand intuitive reports and dashboards that provide a real-time window into your billing and to ensure you are able to understand the current situation and you're planning for the future. Standard reports will include a set of metrics and KPIs at the high level that let you keep your eye on data points that will show issues or problems that you need to dive on immediately. These include enhanced reports. These metrics are deep dives that you want to be able to get your hands on quickly when you need to dig into an underperformance, as well as those that will show you the biggest area of opportunity when regularly reviewed. They also include reviewing your explanation of benefits, dealing with your staff to ensure that they're heightening their productivity on a daily basis, and watching where your revenue is deducted as you move forward in the collections process. Full cycle revenue integrity also is a big part of any plan that you have. Keep your focus on AR, collections, and payment reconciliation aligned to your front and back office processes to help you obtain a higher clean claim rate, to proactively identify and resolve issues that result in underpayments and denials, and optimize your revenue and financial results. And lastly, as the reimbursement environment becomes more challenging, you need to build your expertise in fighting the payers for reimbursements you deserve. Partner with somebody who understands the tactics they use to reduce payments to providers and has the tools, technology, processes, and the know-how to combat them to ensure you receive the reimbursements you are entitled to.
Thank you, Franklin. To summarize, a robust payer collections program has a number of tangible benefits to your organization and your clients. First and most important, a program that leverages best practices will increase reimbursements and combat the decline in rates and the ability to collect from patients, as we discussed earlier. Secondly, it will allow you to optimize every transaction and ensure that you are getting the payments that you're entitled to from payers. It will allow you to maximize cash to revenue, decrease collections costs, and reduce days outstanding. The data and analytics will allow you to improve processes upstream and help you manage your complex claims. And perhaps most importantly, it will improve patient experience as the payers become more accountable and meet their obligations. So in sum, I hope you leave today with a better idea of what's happening with respect to collections, both from the payer perspective as well as from the patient perspective. And hopefully you walk away with some helpful tips in how to put together a payer reimbursement program. Thank you for attending today. Can I turn it back over to you, Angie?
Yeah, thank you, John and Franklin, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. We have received a ton of great questions, and the first one we have is, what part of the payer reimbursement program could I implement right now to get the biggest increase in my reimbursement?
I'll take that one, John. The robust AR follow-up is the most critical component of the program. The same way of processing underpayments and denials just won't work anymore. So you have to make sure you are on top of every claim as it works its way through the process. Utilizing workflow technology pays for itself quickly and immediately when you leverage it to prioritize and fight for your reimbursements. So I recommend certainly some technology to support your efforts.
That's really helpful. Thank you. We have another audience member who asks, will the surprise billing legislation change the way I bill for out-of-network?
Oh, no, I have this one, Franklin. For most providers, the answer is no. Most of the legislation is very specific in the kinds of claims that are impacted. And for those that are impacted, usual and customary will be really able to be leveraged to ensure that you're being fairly compensated. But yeah, I would say no.
Great, thank you for clarifying that. Another question we have is, you talked about technology that would help us not overlook denials and underpayments. What kind specifically can we use to increase our reimbursement rate?
Well, the data analytics and the workflow technologies that you have in place are key. You need to have a tool that will help prioritize your claims as they are in process, ensuring the ones that you need to work are put at the top of your work queue. Data analytics is the second piece. You need to have a dashboard that you are looking at every day that will point you right into the direction of where your problem areas are. Your billing system likely isn't the place for that data by itself. As it is the only one source, you need something that spans all data types and gives you the most complete picture in your billing success. So again, in short, your billing system alone is not enough in order to maximize your reimbursement.
That's really helpful, thank you. John and Franklin, do you have any additional thoughts to add? Any final thoughts before we close the webinar out for today?
I think the point to be made here is to maximize your collections, you definitely want to make sure that we're getting as much money as we possibly can from the payers, the insurance companies. The chances are that trying to collect that same type of money from the patient would cause problems down the line with your revenue cycle, so having a robust, technology-driven collection cycle is very vital to any success of any revenue cycle management operation.
And I would just add, in terms of expertise, I think that's really important. Whether you have the expertise, in-house with your team, or need to bring it in from, outsourcing, you need to make sure you make a good decision with respect to making sure that you have that expertise one way or the other.
Awesome. Those are great insights. And that is all the time we have for today. I want to thank John and Franklin for their excellent presentation and CollectRx for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.